So good afternoon, everyone. Thank you for joining us today. Our chair is Rhonda Seidman-Carlson, immediate past president and chair of the Provincial Nominations Committee. I'm going to give you a brief description of the technical aspects and house rules for the webinar, and then I'm going to turn the session over to our chair. You'll see a photograph of the chair or of each candidate as they're speaking, unless other material has been provided. Providing other material was optional to candidates and not mandatory. If you'd like to ask a question of a candidate, in the bottom right-hand corner there's a chat box. Please type your question there and state the name of the candidate to whom your question is directed to. That candidate will respond, and then each candidate after, in a rotating order, will have a chance to respond. Please type and send your questions to us as you think of them. After all candidates have been given their instruction, we'll then address the questions. Sorry, have given their introduction, we'll then address the questions. Candidates will have 1 minute to respond to each question. And candidates will see a warning on the screen when they have 15 seconds left to speak. If you go over the allotted time, then I'll have to ask you to stop. I'll now turn to Rhonda to chair the session.
Thank you very much. So good afternoon, everybody, and I'm sure that we will have more going on during the presentation. It is Saturday, maybe people are out grocery shopping, I don't know. So today's webinar is for the member-at-large nursing education positions, and the candidates running for election are Karima Aladina, Selma Deb Duval, Elizabeth Edwards, and Shirley Marr. Alicia Ashton withdrew her candidacy today. So we have 4 candidates running for election in the member-at-large nursing education position. We will begin with each of the candidates being asked to speak in the alphabetical order I just mentioned, and each candidate will have 5 minutes to speak, and they will be timed, and as Sarah has mentioned, a 15-second reminder will flash on the screen to remind you you're close to the end of your time. Also, candidates are reminded that they will only have 1 minute to respond to a question, and I will rotate the order of questions if they are addressed to an individual person. That person will answer first, and then I will rotate the order for others to answer. If the question is to no particular candidate, I will still rotate the order so everyone has a chance to be first and also has a chance to hear others' responses. A reminder to members who are online, as Sarah has just mentioned, you are encouraged to type a question and send them in, and we will deal with your questions after all the candidates have spoken. So I'm going to turn to the candidates, and if we could start, please, with Karima Aladina. Karima.
Thank you, Rhonda. First of all, thank you really for considering me as a candidate for the members at large for nursing education. Can you all hear me properly?
Yes, we can.
Okay, perfect. Thank you. I really have had the pleasure to work as a registered nurse for the last 13 years. And during the last decade or so, I have fortunately created some memorable movements within patient care, nursing education, as well as in practice. I have worked as a frontline RN, as a nurse educator, nurse advisor, and nursing faculty, both in Canada as well as in some underdeveloped countries, such as Afghanistan. While working in Afghanistan, I think one of the biggest achievements I can remember of was to really collaborate very closely with the Ministry of Public Health to create a standardized national nursing curriculum. While working in these capacities, I have learned that the challenges we face here in Ontario are not just isolated to our own province. They are much more profound and much more extended to Canada as well as to other countries. I'm very pleased to know, that we are not alone in this challenge, it also actually reminds me of the work that needs to be done to minimize the gap between nursing education and practice. And I'm hoping that through the forums such as the RNAO members at large, that we can and we are actually obligated to lead and support the integration of quality healthcare in nursing education and in practice. I'm very passionate to collaborate with academicians and clinicians to support and drive the future of nursing. Being the current president of the RNAO Halton chapter and as a member of Nursing Education Committee, in conjunction to my current working role as a professional practice clinician at a community hospital, I feel that I am able to use my leadership skills to identify and analyze problems, to develop and implement simple yet innovative solutions to maximize the potential of this role. Thank you once again for giving me this opportunity.
Thank you very much, Karima. We'll now move to Salma Debzival. Salma, please share your thoughts with us.
Thank you very much. Do I have control over the slides?
Salma, would you like to have control, or I could just change the slides for you?
I would love to have control. Thank you so much, Sarah.
Just give me one moment.
Thank you so much.
No problem. Okay.
Wonderful.
There you go.
Great.
So much.
And you see the small direction buttons near the top?
Yes, I see that, and I can just flip in and out of those slides. That's wonderful. Thank you.
Okay.
So thank you again for the opportunity to introduce myself and share with you some of my background and my vision and passion for professional nursing. My name is Salma Debzival, and I believe I was born a nurse. I've been licensed to practice, however, for the last 30 years, 25 of which have been here in Canada. I am an internationally educated nurse. I received my Bachelor of Science in Nursing from the American University of Beirut and have since pursued courses in critical care at Algonquin College, a Master's of Science in Nursing at the University of Ottawa, and I am currently pursuing doctoral studies in public policy and administration with a concentration in health policy. My dissertation is looking at the healthy immigrant effect phenomenon, and I'm exploring the lived experiences of immigrant women with encounters with the healthcare system. My experience has also spanned the domains of clinical research, leadership, academia, and education. Clinically, I have been privileged to practice in a variety of settings and specialties, including medical, surgical, trauma and emergency, pediatrics, oncology and hematology, cardiac and coronary care, and critical care. My research experience has been in the areas of education, student placement and preceptorship, diversity and social inclusion, and most recently in managing a multi-site mixed methods evaluation study across 4 provinces with over 20 organizations. The roles I played in research have spanned the full spectrum of consumer of evidence to a principal investigator role. Though a qualitative researcher by inclination and passion, I have been involved in mixed methods research projects. Within the leadership domains, I have been involved in projects in the local, provincial, national, and international levels. I'm only going to share a couple of examples. At the local level, I've collaborated with the Academic Health Sciences Centers in Ottawa as well as the Academic Health Council on a project to develop, deliver, and evaluate interprofessional education training to healthcare professionals at the post-licensure level. At the international level, I was involved in a collaboration between the Canadian Nurses Association and Queensland Health in Australia to support Queensland Health in adapting the Nurse One portal for use by nurses in Australia. My experiences in education and academia cover both the clinical and academic settings. As a clinical educator in medicine and cardiology, I was involved in the development of educational programs in both specialties, as well as continuing education programs as part of my role in nursing education. As a part-time professor and instructor at the University of Ottawa, I was able to develop, deliver, and evaluate a new course on communication and therapeutic relationships for the Bachelor of Health Sciences program. My joint appointment with the Ottawa Hospital and the University of Ottawa provides me with the unique opportunity of bridging academia to clinical practice. As a result, I've collaborated with the university on research projects and have presented as a guest lecturer on areas of interest for me, namely cultural diversity and social inclusion, interprofessional collaboration, and communication. I have also worked with the Registered Nurses Association of Ontario. So I have worked with the Registered Nurses Association of Ontario as a development panelist with RNAO BPGs. These were embracing cultural diversity in healthcare, as well as developing and sustaining interprofessional healthcare, as well as an invited faculty to a variety of RNAO institutes. I am also a member of the Provincial Nurses Education Interest Group, as well as the Clinical Nurse Specialist Interest Group. I must also add that I have had experience with boards of directors as a director on a board of directors, as well as an employee within a board-governed organization. My areas of interest include social inclusion, health equity, cultural competence, diversity training, models of care, communication, and therapeutic relationships. I've presented extensively on this work, including virtually through YouTube videos, should you be inclined to watch those. I have published original work on some of those topics. I truly believe in a vision of health equity for all, while recognizing that we will not be able to achieve it without a client-centered approach to our practice, an approach that is based on social justice principles and the value of the individual regardless of differences or abilities. I also believe that in order to enact and sustain change, our approach must influence ways of thinking. Changing behaviors alone is not enough. Thank you again, and I do hope you would consider me to represent you as membership at the RNAO Board of Directors. Thank you.
Thank you very much, Salma.
Thank you.
I will turn over to Elizabeth Edwards. Elizabeth?
Thank you very much, Rhonda, and thank you to the current participants for attending on the first Saturday of March break. I'm happy to have the opportunity to speak to you. First and foremost, I am committed to nursing as a practice discipline. I don't remember a time when I didn't want to be a nurse, and so I am very, very committed to the experience of nursing as the opportunity to engage in the lives of individuals who are kind enough to let us in at very interesting and often very compelling and stressful times of their life. As a nursing educator, I have extensive experience as both a clinical educator and professional practice leader in general medicine and emergency care, and I have worked for many years in the academic environment as well. I have had experience in development of individual course curriculum and entire program curriculum at the University of Toronto and McMaster University. I am currently employed as a professor in the collaborative Brock Loyalist degree nursing program at the Loyalist site. I've been here for nearly 14 years, which is quite hard to believe, but was responsible for the development of curriculum in collaboration with our colleagues at Brock. I have experience as a board member as well. I was the regional rep for Brant Haldimand Norfolk Hamilton chapter and the Niagara chapter for 2 terms on the Registered Nurses Association of Ontario board. I am currently a board member on the Belleville Nurse Practitioner-led clinic and children's mental health as well, so I bring a fairly experienced perspective to board work. I believe that the member-at-large education position on the board of RNAO is a unique role. There has been discussion recently about how best to use the board of directors roles and some discussion about whether the member-at-large positions are able to be represented effectively by our vast array of expert nurses in a variety of interest groups. And I believe that specifically for education, because of some of the things that are going on in the nursing world right now in which we're living and working, that is one member-at-large position that I would advocate strongly to retain. Nursing, as I used to know it as a new graduate, which was a long time ago now, has virtually disappeared. The current socio-political climate is calling out to us to consider and to reconsider our future directions in education, practice, and research. As we look ahead to the healthcare of the future, I think that we need to ensure that we provide nurses with the knowledge and skills that they will need in order to support, protect, and enhance the health of their individual clients or their patients and their respective communities. I don't know a nurse who is not deeply embedded in a community in which he or she lives and brings to bear in their relationship with that community the knowledge, skill, and expertise that they have as a nurse. In the midst of change, there's always the opportunity to influence for the common good, and that is a strength of being a member of RNAO. We are well regarded by the public. Perhaps more than any other professional organization, we are well known by the public, and we have an opportunity to influence future directions for nursing that will have an impact on how we educate nurses for the future and has an impact on how, as educators, we develop the curriculum that will help those nurses practice in the future. So as a member of the Board of Directors, I commit to promoting the role of the registered nurse at every opportunity that I can find. I have great faith that my professional organization will support my commitment, and I look forward to the opportunity to represent not just my nursing educator colleagues on the Board of Directors, but all of the members on the Board of Directors. Thank you.
Thank you very much, Elizabeth. I'm now going to turn it over to Shirley Marr. Shirley?
Hi. Can you hear me?
Yes, we can.
Hi. First, I want to thank RNAO, my fellow candidates, and everybody taking part today to listen to us as we tell you a little bit about ourselves. I think the number of candidates show how important the role of RNAO is within nursing today. Secondly, I want to share some information about myself. I graduated with a Diploma of Nursing in New Zealand in 1988 and was unable to find a job there, so I moved to Canada in 1989 and started to work on a medical floor. I went to ICU in 1991 and started my degree at the same time. I graduated from Ryerson University with a degree in 1997. I moved around to a few different jobs in nursing over about the next 10 years, including home care, education and acute care, while I completed a Master's in Health Science and Nursing. Then I became an educator at Toronto East General in 2005. I returned to school part-time at the same time and obtained a Master's of Health Education. I am currently the ICU-CCU educator at Etobicoke General, which is part of the William Osler Health System in Brampton. My major interests in healthcare are delirium, resuscitation, and the care of the older person. I believe that care of the older person will become critical in the next few years. I decided to put my name forward for this position as I wanted to play a role in improving healthcare for all, and I want to ensure that RNs are at the centre of this. I believe RNAO plays a key role in advancing professionalism within nursing. The best practice guidelines are an excellent example of this. However, I believe that RNAO can do more for nursing by translating high-quality research for quicker implementation in a practice setting. Currently, it takes long periods of time, over 10 years in some cases, to ensure the research is used as needed. In healthcare today, there is a large amount of quality research going on. However, this research is not being used as it should be in many cases. The practice area is a place where we need to integrate that research into practice. As member at large education, I would like to see RNAO to stay and to be more active in this. As member at large education, I also want to work to strengthen links with colleagues in universities as well as the College of Nurses to ensure that new nurses are provided with the educational resources they will need to take the nursing profession where it's going in the future. RNAO, working with other educational partners, needs to ensure that all RNs are equipped to meet the changing realities of the world and to advocate for the value that RNs provide. All around me in healthcare, I see examples of RNs being replaced by other less educated members of the healthcare team, and RNAO, as our professional body, needs to be front and centre, stating that this will result in deteriorating care for the public we serve. Another area I want to work with RNAO on is to help them reach out to nurses who currently do not belong to this organisation. I believe we need to talk to these nurses to understand their thoughts regarding RNAO in an effort to bring them into this organisation so it can be strengthened. Thank you.
Thank you very much, Shirley. I'm now going to open it up for questions, and I'm going to turn it over to the RNAO host, who have been hopefully receiving a number of questions. Did I lose my host? Oh, there you go. As MAL Education, how would you engage with members? So I'm going to start with Karina.
Oh, hi again. So I think as a member of large education, to engage within my members, I think I would definitely use and engage the committees that we have, nursing education committee as well as the nursing practice committees, and then really work around with them to be able to reach out to our members at frontline. And one of the biggest reasons would be really to identify what are the challenges that they're currently experiencing. Working as a frontline staff, as well as working within the community hospital setting and very closely with the other community agencies, I think having that formal as well as informal discussion would allow me to really engage with them and identify the concerns. Asking the new graduates if they do feel prepared to transition into the nursing role would be another major way that I would be able to engage with my members.
Thank you very much. I'm going to turn it over to Salma.
As an educator, of course, the first thing you want to do is look at a learning needs assessment or a needs assessment. What is it the members really are looking for? What is real to them? They are not going to be engaged if the issues we are engaged in as an association do not mean much to them. So we need to go back to the basics and look at what they have identified as real issues and address those, and that will ensure engagement. Thank you.
Thank you very much, Salma. Elizabeth, could you answer the question, please?
Certainly, I'll try. One of the things that would be a priority for me as the MAL Education would be to reinstate the Nursing Education Committee meetings that we have with representatives of nursing education in all dimensions: clinical practice, preceptorship, provincial nurse education leaders, and members of RNAO, obviously. As a PNEG co-chair for the last 4 years and a member of PNEG executive for the last probably 7 or 8, one of us was always a member of that committee and brought to that table the discussion about those issues that affected both clinical education and academic education. Also, PNEG has been reaching out to members of the Staff Nurse Interest Group and the Nursing Research Interest Group. So as member at large education, certainly those two groups would be front and center as my resources for looking at what are the needs regarding nursing education and our relationship with other interest groups and other aspects of nursing practice.
Thank you very much, Elizabeth. Shirley, would you like to respond to this question, please?
Certainly. So I think, first of all, I would need to find out how RNAO's Board of Directors currently reaches out to its members, because I don't want to reinvent the wheel if something is already there that is good. Certainly, I would work within the different chapters to reach out to them to find out what their needs are and to see what is happening in their different areas, because what one area might want may be completely different than what other areas. Also, working within the interest groups would also be an important function to see what's happening and to hear what's happening from them. But I just think just making sure that people were aware of you, talking to them. There's such a lot available today that we can use, but I think first of all I've got to find out how RNAO does it now. Thanks.
Thank you very much. So do we have another question from our host? What are your top concerns in nursing education today? So I'm going to start with Salma. Could you respond to this question, please?
Yes, of course. I think one of the biggest things is the erosion in our scopes of practice. We can see that there is definitely a role overlap between our practice as registered nurses and that of other healthcare professionals. And it is important that we go back and see how we can protect our own scopes. Additionally, of course, we are graduating not enough nursing students, and as we are graduating them, they are entering the practice, and then we are losing them. So the attrition of our of our new novice nurses out of the practice is an issue as well. We need to go back and address that, as well as the view within nursing that we eat our young. I hate that expression, and I think we need to go back and be reminded of the fact that we are supposed to care for our young novice nurses. Thank you.
Thank you very much, Amra. Elizabeth, could you respond, please?
I think that my top concerns probably vary with the week, depending on what's happening in the world of healthcare, and that makes it a little bit harder to pin down sometimes. But certainly, right now, my biggest concern that affects nursing education is the loss of roles for registered nurses. There's been significant job loss across the province as funding models have been implemented and new models of care have been introduced to some agencies. There has been significant job loss for RNs. That means then that there are fewer clinical placements available for undergraduate nursing students, and we have a loss of clinical preceptors for pre-grad students and clinical role models for other undergraduate nursing students. So promotion of the role of the registered nurse is a primary concern in that affects nursing education today, for sure.
Thank you very much, Elizabeth. Shirley, could you respond, please?
Certainly. So my big concerns with nursing education today is I see new nurses coming into my hospital on a monthly basis when I teach orientation to them, and I see them they're so hopeful, and then I see them in about 6 months and they've lost that sparkle for nursing. And because I think so many of them have such a culture shock of what they were taught versus some of the realities of nursing. So I would like to see whether we can somehow bring practice, and there's many different areas of practice, closer together with education. I would also like to, as I think it was Elizabeth said, do something to stop nursing eating their young, because that is terrible. It's horrible to see.
Yeah.
Thank you very much, Shirley. And finally, Karima, could you speak to this question, please?
Sure. Thank you. One of the major concerns that I think, in my opinion, is definitely to attract a quality faculty member who is able to support the role of faculty fully. For example, most of the faculty members, at least from my times in university, I recall, are expected to really focus on research and generating research-related revenues. And living within such pressures, the faculty members are not completely able to provide and participate in direct clinical supervision. This issue gets even more complicated when our registered nurses within the hospitals are expected to support and prioritize the learning of medical students and paramedics, leaving our nursing students at times to be mentored by non-RN preceptors, such as RPNs or even sometimes social workers. Nursing preceptors in clinical practice have lack of willingness to precept RN students because there is lack of incentive beyond the idea that they are going to serve the profession. But I think having these are the major challenges. One other, yeah.
You weren't cut off. You still have a few more seconds if there was something else you wish to say, Karima.
Okay, I just thought my time was up, so I just stayed quiet. I'm sorry. But one of the other things that I was planning to highlight was really the variation in orientation. So in some healthcare facilities, the orientation for the new grads would range anywhere from 2 days, 2 evenings, 2 nights, to 6 weeks if they're not part of the new graduate guarantee. If I was to come within the health force, having only 2 days, 2 nights, and 2 evenings, 6 days of shift ready to hit the workplace, I think I would not be able to survive that any longer. So, yeah, definitely those are my challenges.
Thank you very much, Karima. I'm looking to see if there's okay, so what new approaches will you bring to the RNAO Board of Directors should you be elected? I'm going to start with Elizabeth.
Oh, I knew you were going to do that.
I'm rotating.
I think I'm not really sure what this question means. What new approaches will you bring to the RNAO Board of Directors? I'm not sure whether that means that as a board member there's a perception that among the membership that is generating this question that there needs to be new approaches to the Board of Directors. So I'm a little bit apprehensive answering the question because I'm not really sure what it's asking me. I think that RNAO does a very good job, the Board of Directors already, with new approaches by virtue of the way that the board functions and the way that the board is elected, so that we don't have turnover of the entire board every year. It only happens every other year with, MAL positions one year and regional representation positions the following year. So there's always a voice of experience with the board there. And similarly with the president-elect and past president roles, that they support the board being able to function in an experienced way. I think the board is very open to input from the membership, and if anything, that probably just needs to be made known to the membership, that you don't have to wait for resolutions, you don't have to wait for an AGM. You can approach anybody on the board at any time and have your concerns brought forward to the next board meeting. So I think maybe reaching out and making that more vocal would be a newer approach.
Thank you very much, Elizabeth. Shirley, your turn.
So, similar to Elizabeth, I'm not 100% sure exactly what is meant by this. Certainly, I think the most important thing that I would do as a new member of the board is listen, see what they're doing, see what approach they're taking now. As I said in my opening statement, I am very much want RNAO to stand up a little bit more forcefully than what I see at times for the professionalism of nursing and standing up for the role that the RN brings to the healthcare field, because, as I said, I see RNs being swapped out for RPNs and healthcare aides, and I don't hear anything about that. And I really think that RNAO, as our professional body, needs to be standing up, talking to the government, talking to the legislative bodies to say this is wrong. This is going to, although it might save money in the short term, it's going to cost money in the long run, because this is what an RN brings to the table.
Thank you very much, Shirley. I'll move to Karima. If you would like to respond to this question, please.
Sure, thank you. I would first think that the world is completely changing, and RNAO has been, and I'm sure will continue to be, the voice of nurses. But in this changing world of technology and within the economic constraints, I think it's important definitely to us to continue to challenge ourselves and to think innovatively. What could be done outside the box? What is it that we could really do innovatively and creatively to support our nursing students and the graduates? And I think one of the things that I could do at regional, national, and because RNAO is moving even more towards international level, is to collaborate with our partners here as well as outside Canada, just to see what strategies are they using. In healthcare, we are using words and languages such as lean, agile, project management, probably integrating those knowledge into the nursing education and practice, and to see how could we increase more productivity by collaborating, by minimizing waste, by enhancing our scope to the fullest. But I think one important thing that we should constantly try is to at least have some basic standards. So when it comes to orientation, yes, this is the basic standard that every organization should strive for in order to support the grads, but definitely trying to bring all those small little puzzle pieces together.
Thank you. Thank you very much, Karima. Salma, would you please speak to this question?
Thank you. Yes, like my colleagues, I'm not very sure of what the question is about, but I would like to interpret it that it is what unique contribution you might be able to bring to the RNAO Board of Directors, and thus a new approach. And I think I would bring a unique contribution in that I have a bit of a national and international perspective that I can bring with me as a member of the board. And I definitely agree with Karima that we need to look at outside our profession as well as internationally to some of the language as well as what is working out there and how we can adopt it within nursing as well. Thank you.
Thank you very much, Salma. And I'm looking to see if there is another question, or we've reached the end of our questions. Oh, there's a big one here.
Oh, my God.
All right. With more and more emphasis on community care, sicker patients are being discharged from hospital earlier and requiring community-based care. What would you do in your role on the RNAO board to ensure new nursing graduates are adequately prepared to work in the community and have the membership they need to do so? So I'm going to start with Shirley.
Okay, well, this is a great question, and this is an area that I look at all the time with, really trying to get patients out of hospital quicker. But at the same time, you wonder, are the nurses that are working in the community really prepared for that? And so this is something that I think we need to work with our community partners as well as our colleges and universities as well as hospitals to say, what can we do so together as a healthcare integrated team that we can make sure that everybody has those skills that they need. To me, this means an RN is so important because they don't just go in there and do the dressing or the IV or whatever, but they bring in so much more to that. And so I think we need to integrate, make sure our healthcare system is integrated, which I don't believe it is as it should be, and see what we can do to change that for our community partners. Thanks.
Thank you very much, Shirley. I'll move to Karima. Could you please respond to this question?
Absolutely. Thank you. I would say that, like in the challenges, one of the questions where the challenge was being asked, I think I mentioned the lack of availability of dedicated preceptors and RN mentors. So I think I would start right there by start a very strong partnership with our community organizations in helping them understand the mutual benefits of them to support the learning of RNs. Because once these RNs graduate, it's the organizations themselves who are going to benefit, bottom line. My other, probably the important strategy would be to continue to enhance the model of interprofessional and collaborative practice that would actually link the nursing with medicine and allied health team members. That way we are not always working under the direction of physicians, but working with them within our complete full scope of practice. And last and most importantly, definitely having that funding piece attached that could be made available to support the vision and to continue the learning of our new grads. So making new graduate guarantee program much more available, not just to very minimum number of students who are able to. So I think that would make our graduates more prepared with less turnover once upon the graduation.
Thank you very much, Karima. Selma, could you please respond to this question?
Yes, thank you very much. It's interesting that when we look at the new grads, perhaps how we need to fix this issue is beyond just the education and educational preparation. This is really a system issue, and we need, like Shirley mentioned, we need to look at an integrated approach. One of the things that we could do within that is, of course, the electronic health record and the ability to transfer a patient's health record among and between settings, and that will make a new grad's life a little bit easier. But also we need to teach our students to look at the context of the patient. The patient has a story before, during, and after we have been in their lives, and we are there only for one moment and only sometimes as uninvited guests. And we need to teach them to speak about doing with the patient rather than to and for, as well as start discharge planning at admission. Thank you.
Thank you very much, Selma. And finally, Elizabeth, could you respond, please, to this question?
Do I really only have a minute? Because this is somebody's PhD dissertation right here, and we could spend hours discussing this, so I'll try and talk fast. I think first off, there is inherent in this question an assumption that new nursing graduates are not adequately prepared to work in the community, and I think that that's probably not quite correct, but what I think is that new nurses are not comfortable caring for very sick people in the community because their resources for when they are feeling unsure about a sick patient are not there to the degree that they should be. We need to have available to them a mentor, a registered nurse mentor who's well experienced, who's able to work alongside them when they feel the need for that. And I know that that is not happening now. I would be the first person to say that I think we need to probably offer more clinical opportunities for undergraduate students. There are always people have concerns about how that's going to happen, but I think we need to have a very positive approach to that and see if there's ways that we can't make those clinical experiences more possible for them, for sure. And then there are system-based issues there that are of concern. I also think this is a great place for the Member Education Committee to have input into curriculum development and the availability of clinical supervisors and mentors for new graduates, as well as undergraduate students getting those experiences in the community.
Thank you very much, Elizabeth. I'm looking to see if there's another question that's come up. And, we're asking for, are there any other questions from our members who are attendees? I'm giving time for people who might be slow typing. So seeing none, I'm going to thank all of our candidates very, very much for their time and for their thoughtful responses to some excellent questions. And I thank our attendees for posing such thought-provoking questions. I remind you all to look at the voting and when the voting opens, and making sure that to sign on for tomorrow's webinar for our President-elect positions. And I don't know whether our RNAO hosts have any closing remarks.
No, just thank you to everyone, and we will be archiving this on the website as soon as we can on Monday, so you'll be able to refer back or share your responses with other members.
So again, thank you all very, very much, and I wish you a lovely rest of the weekend.
Thank you. Thank you, Rhonda. Thank you, Sarah. Bye-bye.
Okay, bye-bye.
Bye.